Hello, this is Dr. Praveen Ramachandra. In this video, we'll talk about one of the Mounjaro side effects, that is sulfur burps. Why it occurs? It is a mechanistic problem actually. Common fear is that Mounjaro, because the sulfur breath is due to some toxic creation, allergic reaction due to Mounjaro. It's not so. It is mainly it is a GI effect of the Mounjaro, in which the stomach and intestine, they move very slowly, and because of that, fermentation occurs. In a normal people, when you eat food, it's from the stomach. Within half an hour onwards, the food get emptied from the stomach downwards. Whereas when you give the Mounjaro, since it slows down the gastric emptying, that's how it acts. One of the action is decreasing the appetite because of this. So what happens is, due to bacterial action, the fermentation of the food, which is moving very slowly, almost kind of a stagnancy, the bacteria acts on it, and it produces sulfur gas. This fermented sulfur gas can come upward. That's how you get sometimes described as rotten egg smelling burp. So it's because of the slow transit only it occurs. Nothing. It could be an uncomfortable symptom or side effect, but it does not harm in other ways. And especially if the bowel movement becomes significantly slow, constipation is one of the commonly described side effect that can occur. So if there is a associated constipation, this bacterial action will be much more than usual, and the constipation can precipitate more of sulfur breath. And what are the triggering agents you have? For example, the sulfur containing proteins like egg and heavy meats. If the person is taking that, the sulfur breath could be common. And certain vegetable we have a pungent odor like onion, garlics. If you eat more of these, sulfur breath can be higher. And dense macros like dairy products, very high fat, and greasy meals. Once again, since this slows down the movement of the intestine and stomach, the stagnancy increases because of the fatty meals. And dairy products, of course, they can. And complex veggies, if you are eating like broccoli, cauliflower, they are also known to increase the sulfur breath. So what is the action step you can follow? Keep daily food diary and identify which of your medicines can increase the sulfur breath and try to avoid that. So in 24 hours, how we can manage this sulfur breath? First phase, the morning phase, when you get up, you should hydrate very well and move around. Hydrating very well in the morning hours decreases the fermentation one, and second, it decreases constipation as well. So sulfur breath, good hydration in the morning hours can help. And second phase, I would say mealtime phase, in where you can modify the intake, eat smaller portion instead of having two dosas together. One dosa 8 a.m., one dosa 10 a.m., like the 2 hours apart. If you can split the food, smaller portions, which avoids the overloading of stomach, and eat slower to give the your digestive system to process. Eating slow also will help you. And evening phase, I would say prevent eating very late night, because after a late night you go to sleep only, bowel will not move much. Overeating in the late stage can also, late night can also increase the stagnancy in the stomach and increase the sulfur breath formation. Okay. So when to act and how to act? If it is just a rotten egg order and not much changes, whatever the precautions I just told you can follow that. It can be managed at home itself. But if the symptom of sulfur breath is associated with significant diarrhea, fever is also there, and recently have eaten outside or got the food from Swiggy, Zomato to your house, then you have to investigate. Many times my patients come with this, and when we treat for the outside bacterial infection, it helps actually. So we have to, sometimes we have to look for the alternate causes as well. And if it is severe vomiting, abdominal pain, marked bloating, abdominal distension, dehydration, then completely you are not able to keep the food down, then probably you have to investigate further with imaging and other things. With this, I would like to say there are few things which you can modify and which you cannot. Which you cannot modify is the drug itself, that will slow down your digestive movement, that is there. Your doctor or endocrinologist will adjust the dosage as per the symptoms. Sometimes they can reduce the dosage as well. Whereas food volume, which is the one you can take control of, managed by food control by smaller portions, and eating less and avoiding the certain food which I mentioned already. And gut motility also you can control with good hydration and movement and early constipation treatment. So there is a constipation building up, take medication for that. There are laxative, your endocrinologist will advise you, so that sulfur breath chance will be much lesser. So while you cannot change the speed of digestion because of the medicine, but you have other modes like controlling the triggers, controlling the food volume, hydration, and gut motility, you can manage. Thank you very much.